Let's talk about thalassemia MCQs. Quantitative defect of the globin is the thalassemia, and the structural defect of the globin chain is the sickle cell hemoglobinopathy. In the beta thalassemia, there is the decreased function or absent function mutation of the beta globin gene on the chromosome number 11. So, in the beta thalassemia, there is a decreased beta chain and increased alpha chain, obviously. The most common mutation in the beta thalassemia involves the intron 1. It is then core biochemistry entry. So, intron 1 is the answer. A 25-year-old, look here is a hepatosplenomegaly and mild pallor. Why there is hepatosplenomegaly? Because there is a deformed abnormal hemoglobin RBCs. So the spleen try to remove it and spleen become hypertrophy. So there is a splenomegaly and her hemoglobin is 92, that is low hemoglobin, and a fetal hemoglobin is 65%, and she didn't get any blood transfusions, means she has no transfusion dependent. So it is, there is what there is hemoglobin F. Hemoglobin F means fetal hemoglobin, means hemoglobin alpha 2 and gamma 2, that is the fetal hemoglobin that is increased. And there is options major intermediate. Major is thalassemia, beta thalassemia major is always transfusion dependent, lifelong blood transfusion is there, so it is ruled out, and thalassemia intermediate is the answer. Here is also the same type of question. 21-year emergency ward, severe anemia, hemoglobin only 5 gram per deciliter. And here one striking point, that is single blood transfusion. And single blood transfusion means single blood transfusion means she has she has no lifelong blood transfusion, so it is not the transfusion dependent, it is an stress dependent blood transfusion, so it is also thalassemia intermedia. And 23-year-old asymptomatic female pilot, MCB is microcytic and ferritin level is normal range and hemoglobin is decreased, so it is an asymptomatic thalassemia trait. And beta thalassemia, true. What is true in beta thalassemia? All are true except so in beta thalassemia there is decreased or absent beta gene production. So there is alpha and other gamma delta genes are present. So there is hemoglobin A is decreased. Microcytic hypochromic, yes, it is microcytic anemia. Increase hemoglobin A2, that is alpha 2 delta 2, that is also increase, it is true. Hemoglobin F is alpha 2 gamma 2, no beta involvement, so it is also true. Patients require beta blood transfusion. Note that beta thalassemia trait doesn't need any blood transfusion, it is an asymptomatic beta thalassemia trait and it's minor, and it is only detected on the genetic testing and on the electrophoresis. there is normal hemoglobins or mild increase in the hemoglobin A2, hemoglobin F. So this is the answer. Patients requires blood transfusion. And all are true about beta thalassemia trait. Same type of questions. And the most important diagnostic feature of the beta thalassemia trait is raised hemoglobin A2. And the true about alpha thalassemia trait, alpha thalassemia trait means there is a decrease, nor there is a deletion of the alpha gene, one alpha gene. So there is a microcytosis, there is increased hemoglobin A2, that is beta thalassemia options. That is not true. So true answer is microcytosis. And this question is little bit tricky. The hemoglobin F is 95% and hemoglobin A2 is 1.5%. That is less than 5%. It is normal range. And so it is not increased. So it is not a beta thalassemia. It is an hereditary persistence of fetal hemoglobin. And it is an investigation type of question. 2-year-old child. Target cells is seen in the thalassemia. Hypochromic microcytic anemia. Hemoglobin is 6 gram %. Positive family history. There is hemoglobin. There is a positive family history. That is, it is a hereditary disease. So we are in the case of thalassemia, and diagnostic for the symptomatic thalassemia is the hemoglobin electrophoresis. Same type of question in under 17. 118 is the also same type of question. Next rough test, screen test for thalassemia. And 120 is same type of question. Hair on appearance or crew coat appearance on the x-ray is seen in thalassemia and sickle cell anemia also, but the characteristic most one is the thalassemia one. Why there is the crew coat or hair on appearance on the thalassemia? Because there is the ineffective erythropoiesis and increased EPO level leads to the marrow hyperplasia, erythroid hyperplasia leads to the crew coat appearance or hair on appearance on the skull x-ray. Deletion of one alpha gene is silent carrier. All 4 alpha gene hemoglobin BART. Hemoglobin has 3 alpha gene globin gene deletion, and hemoglobin H is 3 alpha globin gene deletion, and fetal hemoglobin alpha to gamma 2, hemoglobin Portland is zeta to gamma 2, and hemoglobin F is raised in it is out of our thalassemia. It's juvenile chronic myeloid leukemia. Hemoglobin A2 are increased in all except, note that in alpha thalassemia there is a deletion of alpha gene. So for the alpha hemoglobin A2 we need alpha 2 and delta 2. So it is not increased in alpha thalassemia. And in iron chelation not used. Penicillamine is not used in iron chelation. Cal for desferrol and deferriprone is used. Okay guys, bye. It's an alpha, it's an thalassemia MCQs practice.